Live Forever Young Radio Live, another show. It's Thursday, May 4th. May the 4th be with you, Bob.
May the 4th be with you, and happy Cinco de Mayo tomorrow.
Right, tomorrow's
Since
Cinco
we
de
won't be
Mayo.
on tomorrow, might as well say it now.
Might as well. But yeah, we just wanted to say hello. This is another episode of Live Forever Young Radio Live. I am Raleigh. That is Bob Gilpatrick.
Hello, everybody. Welcome to Live Forever Young Radio Live.
Amen. So we've got a really cool study that I found on my news feed today. And I told Bob about it, and he said that would be perfect for the show. So we decided to go ahead and share this with you. A brand new drug made by Eli Lilly. There's been some studies and some trials done on this. And what they found is this experimental Alzheimer's drug is actually helping to slow cognitive declines in this large trial that drug maker Eli Lilly, of course, headed up. So the way the story goes is an experimental Alzheimer's medication slowed declines in patients' ability to think clearly and perform daily tasks by more than a third in a large clinical trial. Based on the results, in people with early symptomatic Alzheimer's disease, Lilly said it plans to file for approval from the U.S. Food and Drug Administration by the end of June for this drug, right? So you got a chance to read this, right?
Yeah, I read the whole summary. Of course, we didn't have the study itself.
No, we didn't have the whole study.
This could be huge because we've never had a successful medication for Alzheimer's disease of any kind. And this one is actually dissolving the plaque that forms in a person's brain who has Alzheimer's disease.
Right.
And they said that within 1 year, there was about 50% of the people didn't need the drug anymore because all the plaque was dissolved.
Yeah, I'll read that actually here.
In a year and a half.
Yeah, I'll read over that.
70-something%, right?
Yeah, I'll actually go over the exact numbers here because I have them. But just before we get into that, this reminds me of the podcast we did about CTE.
Yeah.
Remember?
Yeah.
We did a podcast about CTE in which we talked about how literally 99% of ex-NFL football players suffer from chronic traumatic encephalopathy. We define that as being basically from chronic, meaning continuous, traumatic, meaning traumatic events, and encephalopathy means shrinking of the brain, right? Those three things are basically what happens when you get hit multiple times at high impact. And so in a study we were talking about in the podcast, they showed that 99% of these ex-NFL players, when they had the autopsy performed on their brain, was actually riddled with CTE. And when they went further, they looked and they saw these things about the amyloid plaques.
Yep.
Now, these amyloid plaques were kind of like something that was formed from the contusions and the hits to the head, and that ended up messing up the way the signals are sent, right? Because it creates tangles of tau proteins, right?
Yeah. And so with the program we did on CTE, we also talked about how there was another study that showed that inflammation was a precipitating factor in the symptoms.
Exactly.
So if people had very low inflammation, they tended not to demonstrate any problems with CTE. But if people had average to high inflammation, they would start to demonstrate this form of dementia.
Right. Now, how this relates, how CTE and all these amyloid and tau proteins and the amyloid plaques relate to Alzheimer's is it's a similar thing that occurs with Alzheimer's. And so let's just get a little bit into the details Bob was talking about, and we'll get into that in a second on how it actually works with the amyloid plaques. But the medicine is called donanemab, and it works by removing the plaque buildups in the brain known as these amyloid plaques. Thank you. These are a hallmark of Alzheimer's disease, also, like we were talking about with CTE. However, there were some side effects reported, okay? There were 3 deaths in the trial among the people taking the drug, 2 of which were attributed to adverse events such as brain swelling or microhemorrhaging. These are amyloid-related imaging abnormalities. So these were things that were, 3 particular people had an issue with brain swelling. But the trial was run in more than 1,700 patients for a duration of 18 months. Now, the doctor that was the head of this, which is Dr. Daniel Skavronsky, said that for every medicine and for every disease, there are potential risks and potential benefits, right? But he noted, and this is what Bob was talking about, that almost half of the participants taking the drug, 47%, showed no decline on a key measure of cognition over the course of 12 months or a year. That's compared with 29% of people who were taking a placebo, right? So that's the kind of efficacy, he says, that's never been seen before in an Alzheimer's disease, right? So Alzheimer's, and here's just some basic facts on Alzheimer's, right? Alzheimer's affects more than 6 million Americans, with an estimated 1.7 million to 2 million people over 65 in the early stages of the disease, right? We're looking here, drug development for Alzheimer's. This is what Bob was talking about. Drug development for Alzheimer's has been riddled with failures. Specifically, we've never seen anything that really works for it. But Lilly's drug is among a new group showing this promise. Okay. So the medicine, the way it works, right, is given by infusion once a month. And Skavronsky, who noted that he's actually been working in the field of Alzheimer's for 25 years, said this new class of medicines is different because of the amount of amyloid that they can clear from the brain, right? These amyloid plaques, and how quickly that it clears it, right? So the speed at which this works and what the function of it actually is doing with the clearing of the plaques is something that is a whole new class of medicines, right? So it's given by infusion once a month. And the donanemab clears the amyloid so effectively that a majority of the patients in the trial, 52%, were able to stop taking the medicine by the 1 year mark. So that's what Bob was referring to. And 72% were able to stop by a year and a half. So obviously there's going to continue to monitor this group of patients and this trial patients. But they're going to keep an eye, and there's a lot of hope with this type of progress, right? They looked at the participants in two groups. Now, this is where we talked about, remember, the tau proteins in the other podcast about CTE. This is where they start talking about how they looked at the tau to separate these groups of people, right? So in the trial, researchers looked at the participants in two different groups, separated by levels of a brain protein known as tau. The 35% slowing in cognitive and functional decline was seen in the group with the intermediate levels of tau. Now, when this intermediate group was combined with the group with higher levels of tau, the figure was about 22%. So they're still reviewing the results. It hasn't been peer reviewed yet, but they are filing for accelerated approval with the FDA. And based on the results, hopefully we'll have something out in the market or available by early July. So they're moving pretty quick with it. So that's really amazing news.
Yeah.
And when you look at the type of progress that they made, and then you look at what was found, with the research of Alzheimer's and the research of CTE, you can see that they found something can actually attack the root of the problem, which was these plaques, right?
Yeah, it is really, I think it's a really big breakthrough. I don't think this is going to be the end game, of course. I think there'll be other drugs that'll come along now that they've been able to establish this. And also, if you combine it with other things that we'll talk about today, photobiomodulation, et cetera, then you really could have something really great here.
Absolutely. So, this is great. It definitely will help. But there are some things that we've also talked about. And you kind of just mentioned one with, we had an interview with Peter Forehand, the founder of Just Light. And he has found some very good progress in the Alzheimer's area with photobiomodulation therapy, right? And if you haven't seen that podcast, go check it out at boomerboost.com. It's a 3-part series where we interviewed him, and it goes over the history of photobiomodulation, the science of it, and what he's doing to change the game in that particular space for Alzheimer's patients. He's having some really great results, and he's actually, I believe he's towards the end of getting an approval as well as a medical device.
Yeah, he is, and he's getting ready to manufacture them.
Mm-hmm.
So you can go to his website. I think just go to
JustLight.com.
And you can actually sign up to get one of those devices. I think they're going to cost right around $1,000.
Mm-hmm.
So if you have anybody in your family, anybody that that has Alzheimer's disease, the combination of this new drug along with this new discovery of his device, which he calls the sunflower,
Yep.
because he's got it shaped like a sunflower. Basically, what you do is the patient will sit in a chair, and you'll have a pedestal or a table behind them that you put this device on. It's got, a stand and an arm that holds this sunflower-shaped light, and it projects infrared and near-infrared light into the back of the person's head, and it's been showing really great results helping people with Alzheimer's. So I'm thinking that along with this new medication would be really interesting to see what will happen with the combination of the two.
One of the things that we have always talked about as well, and you kind of brought it up, was the inflammation, right?
Yeah.
Now, what you had mentioned is you might have some things that would be associated with Alzheimer's. You might have these tangles and these amyloid plaques, but a lot of them kind of come from inflammation and damage that's been received.
So inflammation leads to the formation of the plaque and the tangles.
Mm-hmm.
And so part of anybody's regime that wants to prevent or treat Alzheimer's is you want to have a strategy for getting your inflammation down. And in that regard, I would say, Raul, we have a whole podcast on inflammation.
Yes, we do.
You can look at. But it also points to, lifestyle issues as well. So you have to be aware of what causes inflammation from your lifestyle. So the number one thing is consuming too much sugar, too many high glycemic index carbohydrates.
Mm-hmm.
And we have another whole podcast about sugar and diabetes.
It's called America's Sugar Addiction, where we talk about the hidden sugars that are in things. We actually talk about how the brain chemistry of someone who's got a sugar addiction problem is almost exactly the same as someone who's addicted to drugs like cocaine.
Yeah.
So that's a very good podcast that'll give you some insight on that for sure.
So that's going to help keep your inflammation down. The other thing is to avoid processed foods, and certainly avoid fried foods that are going to have trans fats. And so fat can be very healthy when it starts out. So you can start with a really good cooking oil, for example, where the fats are a cis fat. And if you heat it up too fast or heat it up too hot, it immediately makes it into a trans fat. And so the trans fats cause a tremendous amount of inflammation, but also not just with frying food, but any food that you overcook, meat that you overcook, not any food, but any meat that you overcook over 300 degrees on dry heat.
Right.
So broiling, baking, barbecue, like that, grill, you're going to end up creating toxins in the meat that are really, really bad for you and are going to lead to inflammation, which is going to precipitate not only CTE, as we said, but Alzheimer's disease as well.
Mm-hmm.
So those are really great things to know, but also probably air pollution, another really big one. There's millions of people die from air pollution worldwide every year.
That's crazy.
And for us in the United States, of course, there are certain cities that tend to trap air pollution from cars, and so there's more smog. similar to what it's like, over in Russia, where the air is so polluted in certain cities there that you're constantly sick to your stomach when you're there visiting.
Mm.
And it contributes to the short life expectancy. But for us here in the United States, port cities are much more polluted.
Yep, we were talking about that. Yeah, in one of our last podcasts, I was talking about how when I used to live in New Jersey, and you could kind of, when you'd go over the bridge, there's the boat yards right there, and it always seemed a little grayer. It always seemed like it was just a little not as bright in that particular area.
Yeah, Port Elizabeth. We have a port here in Tampa. So you just have to be careful because the ships coming in and out create a lot of air pollution. So you need to take care of your lungs as best you can, especially if you're going over by the port where there's a lot of ships that are idling, creating pollution. And you want to also take care of your lungs, the inflammation in your lungs, right? So you can do that by nebulizing glutathione. You can also do it using a product called Prodentum, will prevent certain lung infections. Prodentum's a pill you put in your mouth, and it dissolves, and you swish it around in your mouth, and it kills the bacteria in your mouth, the bad bacteria, because it's made of good bacteria, probiotics.
Right.
So it kills off the bad bacteria, which not only creates problems with your mouth, your teeth get loose, you get gum disease. A lot of people have had to get dentures and, other dental work because of that. But now you have this product that can help combat that. It also helps with your sinuses, help infections.
Nice.
And it also helps with issues in your stomach, bacterial overgrowth in your stomach, your small intestine, your large intestine, because you're swallowing these probiotics that are dissolving in your mouth. Really great product. I use it every day. I take one pill on my way out the door, just grab one, pop it in. By the time I get to work, it's already dissolved and I've used it.
Very cool.
Really good product. We don't sell that product. We do have products that will help with the inflammation tremendously.
Yeah.
And you can measure your rate of inflammation. You can measure your homocysteine level, right? And you can measure your C-reactive protein level, both indicators of inflammation. And you can mitigate high levels of inflammation with counteracting compounds, superoxide dismutase, trimethylglycine, vitamin A, vitamin C, vitamin E, selenium, zinc, all are antioxidants. And we have another whole podcast about inflammation and antioxidants that people can see as well.
Yeah, one of the things that when you look at the body as a whole, and a lot of people don't realize, the neurotransmitters for the brain are actually manufactured in your gut, right? So we have a really good, very unique probiotic that actually will help to manufacture metabolites.
Yeah, right? And it's got pure metabolites in it as well.
Already.
Yeah.
So they're already done for you. So when you create neurotransmitters, it relies heavily on the balance of bacteria in your gut.
That and the fiber as well, which is a kind of a double-edged sword. You want fiber, but bad bacteria also consume fiber. So it's if you want the metabolites without the bad bacteria proliferating, that's why it's good to use the probiotic that Boomers has, is we're the only ones that are already doing the fermentation process. So human guts have good bacteria and bad bacteria. So bad things happen and good things happen. The good is the creation of metabolites. And so what we do in making our probiotics is we take only the good bacteria,
right?
And we take our sprouted barley seed powder, we put it in a vat, we add mineral water to it and the good bacteria. So it's a unique formula. And for 90 days, it ferments, and the same metabolites that are created normally in your gut are created in this vat.
Mm.
And now you have
Right.
a sludge at the end that's all these great metabolites. There's still some good bacteria left in it, but most of it gets used up making the metabolites.
Mm-hmm.
And then there's a cyclonic generator in the bottom of the vat that gets turned on. It spins and creates a little tornado, and it dries out the product so that you can then grind it up, and it nutrient stabilizes it.
Right.
So now you have these wonderful metabolites, hundreds of them, that you can get in a powder form, and you only need a little tiny bit. You put it into a glass of water, stir it up, and now you have these metabolites that are really great for every part of your body, but particularly your brain. So,
one of the things that we talk about with the probiotics that we have in general is people without a colon, that have had their colons removed. A lot of the times they
won't make those metabolites,
right, and and if they take probiotics to do it, it doesn't have the environment to do it in.
Right.
So a lot of times they suffer from metabolic diseases because they don't have the metabolites to help with those processes, right? But with the probiotics that we have, because of the 90-day fermentation process and the fact that during that time, these metabolites that you're actually taking the probiotics and the prebiotics to manufacture are already made for you.
Yeah.
So that's what's really unique about ours. If you look at it, there's not a ton of what you would call live colony forming units in it, because those colony forming units have already been used to make the end product that would have been made in your gut. Right. So that's why, as someone who may have had their colon removed, if you hear the word probiotic, normally like, oh, I can't even use those. With ours, you can, and it actually could help the metabolic processes because of the influx of metabolites, which you're not able to make. So kind of cool, right? Especially when you're talking about Alzheimer's and mental health, and the neurotransmitters that are doing the talking back and forth are created down there in the gut. It's very important that you have a good environment to create them in.
Absolutely. We were talking about things to avoid. Obviously, smoking is one of the things to avoid, which is going to reduce the circulation to your brain. We'll talk about that in a second. And the other is excessive alcohol will also create a lot of brain damage. It's not going to create Alzheimer's per se, but it's just as bad, because your brain does deteriorate from drinking too much alcohol. So those are the things to really know about. The other thing with pollution, Raleigh, we should mention is about your shoes, right? So when you are walking around outside, you're walking on the sidewalk, you're walking on concrete, in the grass, you're picking up toxins on your shoes, you're picking up pesticides from people fertilizing their lawns, you're picking up, you're also picking up tire dust. And when you bring your shoes inside the house, you leave them in the house, they off-gas these toxins in the nighttime. You breathe them in, and you've created toxicity, which is a contributor to Alzheimer's disease and cancer as well. So important to know to avoid that too.
Real quick, a lot of people hear that and they say, really, is that really something that we have to worry about? But if you actually, the National Cancer Institute, is that the one?
The CDC.
CDC,
yeah.
The Centers for Disease Control actually suggests leaving the shoes outside because of that very thing.
Yeah, they say it's one of the leading causes of cancer in the United States.
Wow.
Along with overcooked meat.
Of course.
Yeah, so it's well known in certain circles that these are issues, but the vast majority of the people don't know this because it's just not out there, really. There's only a few people that really even talk about this stuff on their podcasts or lives.
It's true. I think a lot of the reason why is because it's kind of something that that's a little bit in depth, right? And when it needs explanation, sometimes people shy away from that. But one of the best things you can do, really, is go online and see what, like we've been doing, and seeing what the newest things are. And a lot of the times, like we were talking, I said, wow, look at this thing that came out. It's the study about the Alzheimer's drug it reminds me of that CTE show and all the stuff we learned there. So as you kind of expose yourself to new breakthroughs in health and wellness, you kind of can't help but to learn, right? And so I think most people, if you think about it, that's what they're looking for, is the knowledge behind this and how does this work. And by being able to kind of provide that, giving people the tools to kind of do their own research, then they can make some really good health decisions, you know?
Yeah, absolutely. So, you know, another real big thing, Raleigh, is sleep. And we talked about that recently on
Right.
live.
Mm-hmm.
Sleep is something that is crucial to avoid all different types of dementia,
Mm-hmm.
which there are many. So we're talking about Alzheimer's because that's what the drug was developed for,
Mm-hmm.
but that's not the only cause of dementia or for people to have problems with memory and cognition. Another really big contributing factor is what are called TIAs, or mini strokes.
Mm-hmm.
And so mini strokes mimic Alzheimer's disease.
Mm.
So if you have these little strokes and little bits of your brain become anoxic and die off, and then you have another one over the years, now you start to look like you have Alzheimer's disease, when in fact what you have is multi-infarct dementia.
Mm.
And so this you will want to look at our podcast on strokes,
Yep.
on preventing strokes.
Absolutely.
Because preventing those little TIAs, I mean, there's well over 1 million people at any given time in the United States that have dementia that's caused by that.
Mm.
And so it's not enough to just know how to prevent Alzheimer's,
right,
or to treat Alzheimer's. You also have to understand all about strokes at the same time.
Mm.
And there are other types of dementia too, but one of the biggest contributing factors is circulation to your brain, the supply of blood to your brain, which is bringing oxygen to your brain, and it's bringing nutrients to your brain.
Absolutely. A lot of people don't realize that one of the things that is super important for the brain, right, is good circulation. When you actually think about it, the brain, you kind of, it's like up there and it's doing its own thing, but it's actually, not only is it the leader, but it relies heavily on good circulation, because if you don't get the nutrients and the oxygen that it needs in order to function, you're going to start having, I guess what you could say, mental health disorders. They form quickly, especially if it's like your whole body. Like we talk about, if you don't have that foundation of nutrition that allows your body to kind of rebuild and repair itself, then anything that it's repairing a lot of the times is flawed. And that's kind of what happens as you get older, right? You don't make enough of some things. You don't make enough antioxidants to battle the inflammation. And so your body gets overwhelmed. Then you start getting issues like this.
Yeah.
You know?
Yeah. And there's things you can do to improve your circulation. Definitely. One, of course, is exercise.
Mm.
We know that people who avoid exercise are more susceptible to dementia. All right. But the other is, a big part of circulation is nitric oxide,
Mm-hmm.
which is helping to dilate your capillaries. And
right.
the microcirculation, which is 75% of your total circulatory system, those little capillaries are microscopic. They're 1/100th the size of a human hair.
Mm.
So they're literally microscopic, but that's where the action happens. The rest of the circulatory system is to get the blood to the capillaries, which then expand and contract to create a pumping action to make the blood flow.
Right. Vasodilation is the term, right. Isn't it?
Yeah.
Yeah. Okay.
And so arginine is a precursor to the nitric oxide, which helps that expansion. So that's one of the reasons why we have arginine in our Boomer Boost product.
Yes, we do.
And the other thing is, to create circulation, you need proper nerve conductivity.
Mm-hmm.
So your nerves have to be in good shape. and your nerves are cells that need oxygen and nutrients to perform,
Right.
and it needs circulation to perform. So you want to make sure your circulation is in good shape so that your nerves will be in good shape. But then the other thing is, well, we evolved in a certain environment on planet Earth.
Right.
We have sunlight is one thing, and we have an atmosphere that filters the light so that we can actually live in light, because with no atmosphere, the light would scald us. You couldn't really live if there was no atmosphere filtering the light.
Right.
Yeah. But then also there's oxygen in the air that we breathe. When we breathe in air, there's numerous different gases in the air, but the oxygen is what's keeping us alive.
Mm-hmm.
But nitrogen to a degree as well, and nitrogen is what makes the plants grow that we
Right.
eat.
Right.
That the cows eat that we eat.
Right.
So nitrogen is crucial,
essential,
and so that's the atmosphere part of it. But we also evolved in electromagnetic energy that is coming from the sun, but it's also coming from the core of the earth. And our capillaries respond to pulses of electromagnetism. It's coming from the core. The core of the earth is rotating inside the earth itself, and the earth is rotating.
Right.
So you have this dual rotation. It creates these pulses, these pulsed electromagnetic forces, and our arterioles and venals and our capillaries are responding to these pulses, and it causes them to contract and relax.
Right.
And so that's another real important part to pay attention to.
One of the things that we've shared about, we've done a couple podcasts about, it's called PEMF.
Yeah.
Pulse electromagnetic fields, and there's devices that they actually, I believe, astronauts use when they get back from being out. So you're out in space, right? And you're farther away from these pulsed fields that the Earth emits. And what you don't realize is that your body relies on those, right, for the circulation. Well, you just told us, but you don't realize that until you go out into space, and then you come back and your muscles are atrophied. And your circulation isn't as good. Your blood pressure is not as good. That's because you've been away from Mother Earth that provides these pulsed electromagnetic fields that help to cause this vasodilation or circulation of these microcapillaries. And so when these astronauts get back, they have these issues. So they expose them through devices, usually mats that they lay on, to these pulsed electromagnetic fields that then kind of kickstart the circulation, right?
Right. And even if you don't go into space, as you age, your body becomes much less photosensitive.
Correct.
So the pulses are still coming, but your body's not utilizing them as well. And so as people get to be 30, 35 years old, your circulation starts to drop off. And by the time that you're in your 60s, you're going to have about a third less circulation. But these mats you can put underneath your mattress pad in your bed, and it's hooked to a power supply that produces those PEMFs and they're mimicking the ones coming from the core of the earth.
Mm-hmm.
And you can lie on these mats for 8 minutes in the morning, 8 minutes in the evening. The effect lasts for about 14 hours. It increases your circulation by about that third that we're talking about, a little less, average of 29%. But so now you, as a person who is getting older, that's going to be at risk for dementia because of poor circulation. There's a study at Cornell University that verified this. And you can get one of these devices for your home and increase your circulation back to what it was like when you were younger than 30 years old. Very valuable way, very valuable help in preventing dementia.
You were saying, and you kind of said, even if you don't go into space, right, and you get older, I kind of snickered, but with everything that's happening with all the space travel, you might actually go into space and be there for a little while in the future.
Yeah,
and
go
if
up
you
with
do,
Richard Branson.
make sure you bring your PEMF with you, right? No, I'm just kidding. But but seriously, when we look at things like this and we think about, how not just what we eat and what we think affects our health, but how the environment affects our health, it makes you think to yourself, wow, I should pay better attention. Like the thing with the shoes. How many people really realize that? Not many, and I think with Alzheimer's and things like that, one of the questions that a lot of people that I hear about Alzheimer's is like, what is the beginning of it? How does it end up happening? How do you prevent it? So I mean, over time, I think is where this amyloid plaque builds up.
Yep.
Right.
Yeah, and it's precipitated by inflammation. So, proteins are not static things.
No.
Protein is made of many ribbon-like looking strings of amino acids, and they combine together. They get bonded together with the help of enzymes, and they then continuously fold and unfold, and it's doing it through polarity. Okay, but there are numerous different things that can make those proteins not fold properly. And so they fold with errors, and so they're not performing their function properly. And some of them, because of this misfolding, actually become plaque. So there's a lot to the whole science of protein synthesis, as well as the veracity of the proteins. But in general, you want to keep your body in really good physical health so that you have the best chance of all of your metabolic systems functioning properly. So avoid toxins, make sure you get enough sleep, make sure your circulation is as good as it can possibly be, and most importantly, make sure your inflammation is as low as it can possibly be. And so get it tested. That's when you go to the doctor, ask them to test for your homocysteine level and your C-reactive protein level.
We were just talking to someone who's very close to us, and they were telling us that their A1C, which is their sugar level, went down significantly. Actually, someone who uses the products regularly, it's one of the major changes they made in their diet. Their A1C, they're diabetic, their A1C went down significantly, and that their CRP, or C-reactive protein level, has gone down significantly. Now, a lot of the times when you go to the doctor, the C-reactive protein, they're not going to check for, right? Same thing. One of the ones that you'd think they would test for all the time, but they don't, is vitamin D. Vitamin D is another one. So we have some great podcasts. Actually, there's a blog on boomerboost.com called Know Your Numbers. And that actually goes over all these tests that we're kind of talking about, and, what they show and how they work. So if you haven't gotten a chance to go, check that out, boomerboost.com. Click on the Live Forever Young Radio. It says LFYR podcasts and blogs. If you click up there, you will see recipes, you will see podcasts, you will see blogs, you will see self-help. So a lot of the times we talk about tapping, which is the emotional freedom technique to help with stress and anxiety. So go check that out. But another thing that we were talking about, and we were so obviously a big precipitator of Alzheimer's is the toxins, the inflammation, right? Well, a lot of these, the sugars, right? Eating unhealthy, not exercising, bad circulation. So we know that those are the things that cause it. Now, what are some things we can do to prevent it? Well, you said exercise. You said increase our antioxidants. But when you talk about the brain in general and the function of the synapses here, right, to keep those active, memory games are good, right? Doing crosswords, reading, not reading shuts that part of your brain down. And a lot of the times, since we're so used to watching the television or pulling up something on our phone, we don't read. And so those are some very simple things: memory games, playing cards, communicating with people, calling someone on the phone, trying to remember the phone number.
And learning new things.
Exactly.
Very important. The other thing, Raleigh, that is, we see this quite often in the nursing homes. When I used to run nursing homes,
Mm-hmm.
people would we would receive an application for someone to come to the nursing home, and it would say that they have dementia, or they would say they have Alzheimer's.
Yes.
Of course, back then they didn't know that they had Alzheimer's because they didn't have biophotonics to actually see into the brain and be able to tell. But they would write that down. They have Alzheimer's. When we had a very astute medical director, and the first thing that we did when the people would come to live at the facility is we would know that there's a good chance that they actually had depression and not dementia as a cause, but that the depression was making it look like they had dementia. And so we would treat them for depression. And many times, as soon as in a couple of weeks' time, as soon as the antidepressant kicked in, their dementia would clear up. And
now, when you so you're in the nursing home, people come in, oh yeah, they got dementia. Nothing you can do. But your astute medical director says, well, a lot of the symptoms of dementia look like the symptoms of depression, right? Mm-hmm. Is that what it was?
Yeah, exactly.
And
well,
so
they don't look like depression. The depression is primary, and so the person starts to withdraw and not participate. And so the next thing you know, people are going, oh, that person has Alzheimer's disease.
Okay, right? So it's kind of the depression is what's really making that dementia, it look like dementia.
Yeah, it can look like it. So that's one of the things that people can do nowadays is especially since 2020, the levels of depression have been going up.
Absolutely.
And so you don't want to immediately assume that someone needs an Alzheimer's drug because they have dementia or memory lapses. First, find out if they have depression. So, and there's a lot you can do. Certainly, the probiotic we talked about earlier can help with that because it's providing more of the substrate that creates serotonin, which is that. And also, quite often, people with depression have a low number of receptor cells for the serotonin. And you can use a special aloe product to help stimulate neurogenesis to grow new receptor cells. And in certain scenarios, you can use a Fisher-Wallace stimulator because if people have low nerve conductivity in the brain, then the little BBs of serotonin have to jump across a synapse to hit the receptor cell where all the magic happens. And a stimulator that you can put onto your temples, turn on a very low-level electrical pulse that will allow for those serotonin neurotransmitters to easily make it across the synapse. And so that's a really good way to help people. And I actually helped a man many years ago by introducing him to the inventor of that device. And this man was a very famous inventor himself who was starting in his mid-90s, was starting to get dementia. He couldn't remember things that he should have been able to remember. He'd be talking to you in the middle of a sentence. He'd be like, oh, what's the word for that? And he just couldn't pull it up anymore. And all his life, he'd been a brilliant man. He worked on lunar lander projects. He invented a number of things like Teflon, plumber's tape. He invented the devices that mountain climbers use with their ropes. Carabiners he invented. And he actually had got to meet me because he was on the board of directors of a robotics company back in the 1990s. They actually had a robot that was in the movie The Titanic, and it was called Lamprey, and it was a robot that went underground, and it was the first exploration of the Titanic. So they did it with this robot, and he was on the board, and they were selling that robotics company, and they commissioned me to help them sell that company, and he was complaining about this memory loss. So we back before the Fisher Wallace company, when Dr. Liss, the original inventor, was still alive, we used a Liss stimulator on this man's head, and he sewed it into his baseball cap and had the leads coming down behind and into his shirt, and no one could even tell he was using it.
Wow. Okay.
And he started using that device, and sure enough, his memory started to improve.
That's great. And now we talked a little bit about it before, but that's actually an FDA approved thing, isn't it?
FDA approved for treating depression, anxiety, sleep disorders, and cerebral palsy, things like that.
Yeah, and that's from just basically finishing the electrical circuit, right?
Yeah,
that's what it does?
It's raising the electrical potential. The circuit's there, but it's not high enough.
Got you. So it's giving it some more juice.
Yeah, right.
It's like cranking up the volume.
And the inventor was Dr. Liss, was the one that figured out the pulses of those electrical pulses at the synapse, because it's not always on. It's making these very quick pulses where it's on for a certain number of nanoseconds, and then it shuts off, and it goes on. And he figured that out, and he figured out the waveform necessary, and then he invented a device that produced it.
Gotcha.
And you can run it through the skin of the side of your temples, and it runs right through your brain.
There you go.
Next thing you know, people with depression were better and got off their medications, and that's what the FDA gave them an approval for that.
Well, there you go.
So this is just one example.
And that kind of brings us back to what we started with, which is this Alzheimer's drug, right?
Yeah.
And so if you guys, if anybody's tuning in right now, maybe just coming on, Bob and I had found this new study that was talking about the slowing of cognitive decline with a new Alzheimer's drug that was actually being made by Eli Lilly. So that's where we're at. And we were kind of talking about the amyloid plaques, how those are what it's being cleared by this drug, and then the difference in the tau proteins, and how the tau proteins that are affected by these plaques are actually being able to not be as affected because they're being cleared away. So pretty interesting stuff. And something like in the article and what we were talking about, we've never really seen something that tends to work effectively for Alzheimer's. So there's a lot of hope for someone who might be suffering with that now. So,
yeah, that between that and reducing your inflammation and the photobiomodulation, I think is going to be huge. So if it was me, I would do those three things at once right away at a minimum, right? Get the products that you need from us to reduce your inflammation.
Right. You're talking about Gladiator, Barley, Boomer Boost. Lots of really good stuff, like resveratrol 2 is helpful.
And turmeric.
Turmeric is amazingly good for lowering inflammation.
So do that, get your inflammation down, right? And then make sure you also increase your circulation, which we talked about, the PEMF device that you can get. You can call us or connect with us about that, and we can show you how to get one.
Also, Boomer Boost is great at increasing circulation because of the compounds in it.
Yeah, both the arginine and the phosphatidylcholine.
Correct. Right.
And then check out the Just Light website, justlight.com, for the photobiomodulation device.
Also the podcast on that. It's called basically learning what is photobiomodulation is the first one, and from there you'll find the other two.
Yeah, and you'll be able to see the inventor who we interviewed.
Yep.
The inventor of the sunflower, which is the name for the device that helps with Alzheimer's. And I think what's going to happen, Raleigh, is people are going to be able to use a combination now, where if they get this new drug, they get a sunflower, they get their Boomer Boost and Barley, who knows what might happen, with the treatment of Alzheimer's disease.
Well, I mean, you've got lots of different tools that can work well together. From what they're saying, the drug will help to clear out the amyloid plaque. Well, what created that? The inflammation, right? The toxins. So get the stuff. Once you get that cleared out, get the stuff that keeps it out, which is antioxidants, like we talked about, Gladiator, Barley, Boost, turmeric, resveratrol. Use all those things to keep that inflammation down. Because what happens when you keep your inflammation down, your body can repair faster than it's burning.
Yeah.
Right. Like Bob always says, we're like a log in a fire. We either burn fast or we can burn slow. Right. And the more antioxidants you take, the slower you burn, the better your health, the longer your life. Right.
Yeah.
So that's the whole point. So you get, if you do have an issue with Alzheimer's, you get the drug, helps clear out the amyloid plaque. You address the inflammation, then you maintain it. Right. You exercise. Right. You get the circulation up, continue with the exercise. You do your cognitive memory, your memory training, read a book, make sure you're playing, do a card game, do a memory game, crossword puzzles. Make sure you're making those synapses or those electrical things, responses, those electrical currents, make sure they're working. And if you've got an issue where you might need something like a Fisher-Wallace stimulator, check that out too. There's lots of answers. They're just, multiple answers to help, multiple tools to help answer one question, which is how do we deal with this?
And people can hit our website and they can call us on the phone if you need additional assistance.
Yeah, 1-800-861-4609. We've got Gene, we've got Jim, we've got Steph, we've got Lucy,
and
Ann. And Ann knows all about the PEMF. Mm-hmm. She's actually she's been trained in PEMF technology for the last 10 years?
Yeah, I would say at least 8.
Yeah.
And she's been to dozens of trainings. She's traveled to Europe where the inventors are and met them and the whole bit.
She's always updating her knowledge base. Every day she comes in and says, "Hey, Raleigh, look what else I learned. Did you hear about this? Listen to this." And it's like, whoa, wow, Ann, how did you, I found this thing and I went, I learned.
She texts me all the time with new studies.
Yes.
She's great.
Yeah, so don't, we're saying, don't hesitate to give us a call. If you have some questions, 1-800-861-4609. Go to boomerboost.com. Please look and check out all our other podcasts. There's about 80 of them.
Yeah.
It's about 80 podcasts, probably about 80 blogs, maybe a little less on the blogs, but we're always adding. And so what we're doing now, if you can't tell, is we're going live on all the platforms.
So subscribe.
Yeah, we've got TikTok here. If you're on TikTok, follow me on TikTok so you get a notification. If you're watching this on YouTube, make sure you subscribe and hit the notification button. If you're checking us out on Facebook, we're there every Tuesday, Thursday at 11 a.m. EST. And we look forward to having more people join. We're talking about doing some exclusive stuff for our products on some of the future shows. So don't miss out on that stuff. And, we find really cool stuff to talk about. But if there's a topic anybody wants us to talk about, don't hesitate to put a comment down. Put a comment in the bottom here and we'll look at them. I always check the comments. If you want to write us an email, feel free to do that. boomerboost@boomerboost.com and let us know something you want us to cover.
There you go.
There you go, my friend. There you go.
Thanks,
So,
Ron.
yeah, I was just looking here. It's been about 55 minutes. We usually try to go for an hour. So I thank you. Looks like there's about 3 people watching. Thank you guys for hanging out with us. I see I got a couple chats in here. We've got Silver Wings. I take Boomer Boost with Gladiator Barley, turmeric, walk 4 to 5 miles a day, and also take collagen. Wow. It all helps me. Thank you. That's you very much for that great comment. And this is great. This is why we're doing the live. Please feel free to drop by, even if it's for a couple minutes, and say hi. If I get a comment in here and it's relevant, I'll be happy to share it. So that comes from Silver Wings. So Silver Wings, I like that. Thank you for following us and watching us. And apart from that, my friend, I think that's it on this topic. We'll have to have another one for Tuesday ready.
That's good. We will. We will. Thanks everybody for watching Live Forever Young Radio Live.
See you on the next one, guys.